This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning and happy last day of 2021. So this is a medical minute on a study I saw recently. The study was actually called the Bougie trial, and it has to do with bougies. So if anybody is unfamiliar with what they are, just a quick refresher. So it's called an introducer or bougie, an endotracheal tube introducer, and they have multiple uses, but the main idea is being used as a rescue device. If there's a difficult intubation where we cannot see the airway well, instead of trying to push the endotracheal tube into the trachea, you can pass this little narrow introducer. And sometimes it's just smaller and you can get it in. Also, you can place it almost blindly with a little bend at the tip, kind of get it under the epiglottis and feel the tracheal rings. And then just by feel and getting the bougie in, then you can have, while we hold the bougie in place, another person ideally will feed the endotracheal tube over the bougie into the trachea, and you take the bougie out. So it's a very good rescue device for difficult airways, but there's also some people who have suggested that it can be used as a first pass. Instead of trying to see the airway and pass the endotracheal tube initially, just every intubation could be done with just a bougie because, you can get the bougie in, then get the tube in. You don't have to worry about, if it's a difficult airway, potentially moving on to the bougie. So the trial that just came out a couple of weeks ago in a pretty, large trial, well done. It was in JAMA, a pretty well-respected journal, basically randomized intubations in the emergency department or the ICU to either regular intubation with an endotracheal tube with a regular Stylet, or the bougie first, not as a rescue device, just as an intubation, to see if there was improvement in first pass success rate. So there was, like I said, a big trial. It had 1,000 patients. A lot of intubations were done in the emergency department. And in this trial, there was no difference in first pass success rate. Kind of low for both, about 80% in both arms. Hopefully we get more of our intubations, a little more than 80% on the first try. A lot of the intubations were done by residents in this trial, which could affect some of it. But overall, it was a very well done study. It was, a good randomized trial, and there was no difference. It doesn't mean that the bougie is not a great rescue device, but maybe there's not a need to use it first time. So partly I wanted to just do this medical minute to review so everyone knows if we ask for a bougie, know what it looks like. They're usually kept with the airway stuff in the airway cabinets. It's something that potentially, almost every intubation, ideally, it would be ready in the room just so we don't have to go looking for it once we get into a difficult spot, because sometimes you can't really predict a difficult airway. So bougies, know where they are. They should be around for most intubations. Any questions or comments?
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.